Is it recording?
Yeah.
All right. So this week I did Mo's story, which is ethics in mental health and public health nursing. So a little summary about Mo's story um, starts with him expressing that he dislikes his job due to him feeling extremely nervous and has even avoided some presentations, which ultimately leads him to want to quit his job. However, his brother, Ray, advised him to see a doctor first. So, over the next few weeks, Mo schedules several appointments with Dr. Tolgan. Well, first with Dr. Abbott, who um, refers him to Dr. Tolgan, who specializes in anxiety problems. And it is revealed that Mo has an extensive family history of mental health disorders, including an uncle with schizophrenia. So Dr. Tolgan asks Mo's permission for the CACNA1C gene test, which has been linked to mental disorders such as bipolar disorder, schizophrenia, and major depression disorder. And the genetic test came back negative. So Dr. Tolgan ultimately diagnoses Mo with social anxiety disorder. So that's just the quick summary of Mo's story. And I hope you guys had the opportunity to go over the PowerPoint. So, from the story that we had to go over, case study number 5, did you think that Mo's brother Ray act in his brother's best interest?
I think so. Yeah, because I mean, um, it's a job, so I mean, all jobs kind of suck a little bit, and I'm sure everyone wants to quit at some point. So before making like a pretty rash decision, I thought it was smart that he recommended he kind of try and fix his mental like psyche first to before he makes.
I agree. The only thing is that maybe the way he said it could have came off, I guess, um, not very the best. Like I think he said why, like that was like versus like I don't know. Sometimes it's just the tone of it can carry a message differently, but I do think he meant it for like the best interest of his brother.
Yeah, I agree with both of you. I think that he was coming from a good place, but I mean, because we're reading it, it might have come across as like, oh, it's not that bad. Like, just suck it up, go to your job, and get help. But I think deep down, like, it was for his best interest. So, is Mo's opinion of his colleagues' reactions to his behavior accurate?
I feel like it's when it comes to social anxiety, I feel like people who have social anxiety tend to overthink and think that people may be talking about them, even if they never had an actual experience of somebody being like, hey, like you are a horrible person. Like nobody may have ever actually told them that. So, but like in their mind, they just assume that people are because of the social anxiety aspect. So, um, I don't know, maybe something did happen in his life where there's a reason why he's feeling like that, but I feel like it is justifiable if since he does have social anxiety. Um, I don't know. I kind of lost my train of thought and I'm sorry. So if somebody wants to continue.
Yeah, I totally get what you're saying. Like, it's not anybody else's place to discredit how Mo is feeling because if he has anxiety, you can't say that his feelings towards his colleagues aren't accurate because it's how he's feeling. So I totally agree with you.
And I think the issue of like discrediting his feelings is like very unique to like anxiety disorders in particular. You know, if you were to have a seizure disorder or like diabetes, for instance, no one would ever tell you like, shake it off. This is all in your head. It's totally fine. But it is still like a mental illness that like needs attention and needs like prescription care. So, but like it's definitely one of the first that's like readily like, oh, you're just nervous, get over it. Like stop thinking, no, nobody's thinking that. Don't worry about that. Like it's definitely associated with the stigma around anxiety disorders as opposed to like other disorders.
Yeah, I'm glad you brought up the word stigma because that's part of one of my discussion questions, and I think that had a big role in this case study. So next question, were boundaries between patient and provider clearly identified?
I didn't think there was a problem between the interaction between the providers and, you know, the patient themselves. Like, if anything, there was like a proper referral, they got consent, and if anything, they talked to them in a very like therapeutic way where it's like, okay, this is a treatment plan. How do you feel about it? Or like a fine alternative for them. I thought it was, it was a good communication between and boundaries between all of them.
The only thing that I didn't necessarily agree with was when, like, towards the end, Dr. Tolkien was like, um, well, in your case, you just have social anxiety, which is so much easier to treat than depression because you don't have depression. So it's going to be super easy, smooth sailing from here on out. And I just feel like as a provider, I don't think no matter what the situation is, a provider shouldn't be telling their patients that the road to recovery is going to be easy, because if it isn't, then they're going to lose the patient is going to lose trust in the provider and the system in general, because they're going to be like, oh well, Dr. Tolgan told me this was easy and this is like the hardest thing I've ever had to go through. Like, I can't trust anybody anymore. That was the only part I think that I was just like kind of iffy on. But I don't know if anybody else has any thoughts on that.
Yeah, I could see how like you don't want to like psych the patient out and be like, oh, this is going to be horrible. You're screwed. But going too far either way is just bad. Like you can be like, oh yeah, it's very manageable. You're going to be able to get through this, but you can't be like he didn't. Like, oh, it's going to be a breeze. No need to worry. Just you're going to.
Yeah, I completely agree. And that's kind of what I was going to say, Patrick, is like, you want to be encouraging, but again, saying like, oh, it's going to be easy. Well, if it was easy, then he wouldn't be seeking a doctor for help with it. He would have been able to fix it on his own. So clearly it's not something that's just easy and a breeze. But I like Patrick's words of this is manageable. And that's it, with anxiety, that's exactly what it is. You manage what, your actions and reactions to things with anxiety. So I think that would have been a much better approach.
Yeah, I definitely think that Dr. Tolgan kind of downplayed everything, and it's generally treated with psychotherapy, medication, or both, which can take work and time to really start working and notice like lifestyle changes, and like having like a support system can help combat anxiety. But in some cases, people still have anxiety all the time, but just having it at a manageable level where you can live with it and live a quality life is something that Dr. Tolgan should have went over with him, because it's like saying, oh, here's a medication, go take it and you'll be cured. I kind of think that's what Mo kind of got from Dr. Tolgan by saying, oh, it's easy to treat, but there's also like talk therapy involved, which you just don't go to once and then you're cured. So it's definitely something that Mo needs to keep up with. And I mean, obviously the case study cut off at that point. So I don't know like the plan for Mo that Dr. Tolgan presented, but I definitely think that Mo was given like false hope. So the next question, was Mo receptive to her suggestions for treatment?
I think he was. I don't think we really got too far in. They didn't really provide a ton of detail afterwards. It just kind of got cut off, like you said. But it seemed like he just wanted to get it under control because he didn't want it to control his life. So I feel like he was willing to do whatever it took to get that help. So
Yeah, I definitely agree. I included that in my presentation that he was a very vulnerable patient because his anxiety was just taking over his life. And I feel like whatever Dr. Tolkien suggested to him, he would have just agreed with because it was just so debilitating to him. So yeah, I agree. Okay, so we can. And the last question was, were any lines blurred between patient and provider? And I think we kind of touched on that before. So we can move to the discussion questions if you guys are ready. So my first discussion question is, do you agree with Dr. Tolkien with performing the genetic testing? Why or why not?
I agree with it just because it's kind of a cover all your bases type thing. Because if there's a family history, there's the possibility that he could have what was it, schizophrenia or whatever the mental illness was. So I think it was a smart idea.
I
I also
kind
think
of.
it was, oh, sorry.
No, Allison, you.
I also think it was kind of a smart idea, but like as somebody in medicine, I'm not offended by like extra tests and diagnostic procedures. Some people might be. They may have been like, well, wait a minute, why did you do this thing to look into something that kind of wasn't related? I'm like, as an attention, like, not an attention seeking, sorry. As an information seeking person, like I would appreciate just that, even if it comes back that I don't have that gene and it's not related to schizophrenia or whatever, I would appreciate just the plethora of information. But a lot of people would kind of maybe consider that evasive. So, but I don't think he did anything wrong.
I agree. I also think that it gives the patient peace of mind because he kept saying, am I crazy? Am I crazy? So it's kind of good to know that, he doesn't have schizophrenia or like, the family history of like mental disorder, but just anxiety. So it's like one less baggage, I guess you could say.
Yeah, this was an interesting piece of the case study because at first when I read it, I was just like, I don't see anything wrong with this case. But I read it a few times and it's the way the case study words it and kind of the reason why Dr. Tolkien ordered the gene test. And I can read the line that made me realize like it wasn't so ethical for her to order the the gene test. It says Mo continually uses the phrase, "Am I crazy?" which concerns her as she connects this to his story about growing up with his uncle who is diagnosed with schizophrenia. So to me, it just seems like Dr. Tolkien heard Mo say, "Am I crazy? Am I crazy?" and just kind of thought, "Oh my God, he might be schizophrenic," which kind of stigmatizes the word crazy and mental health together, which I think wasn't right. Like her motivation to order the gene test wasn't the correct reason. And I think in this situation as well, like Mo, he was in a really desperate, anxiety filled state. And I feel like bringing up schizophrenia might have like freaked him out even more because it was just something that happened 8 months ago. That was probably because he was really stressed out in his job. And then next thing you know, Dr. Tolkien is mentioning, oh, you might be schizophrenic. So let's do this gene test. So I personally do not agree with that. But at first, I do agree that I was like, oh, Dr. Tolkien is just being like thorough and making sure everything is okay with him. But yeah, those are really good thoughts. So the next discussion question, what about Dr. Tolgan's diagnosing and treatment did she do adequately? So what about her treatment and diagnosing process was right?
I think she was right to, it says that she performed a full physical assessment in order to rule out anything medical related that would be causing his symptoms. And then it says, like, with that family history, which is also very important to do, does the the genetic testing based on strong familial history of different things. So I think that that entire like route was done very well, in my opinion. Like she didn't just go like, oh, yep, let's just throw a label on this. Like she did her due diligence in like going through the steps and like process of elimination. And then it even says like doesn't meet the DSM-5 criteria for this. So obviously he met DSM-5 criteria for like anxiety disorder. But I think in the diagnosing part, I think that went very well, in my opinion.
I agree with Danielle. I think the fact that she did the thorough physical assessment up front is like very like she wasn't going into the situation with any bias. And like the ordering of the genetic testing, I think definitely like addresses one of stigmas around mental health. You know, if you were to go in for like a physical complaint and they were to look at your family history and say, hey, there's a massive history of hypertension, so we did a lipid panel, even though that has nothing to do with what you complained about, most people probably wouldn't be offended. But if you go to a psychiatric complaint for like a complaint of anxiety and there's a history of schizophrenia in your family and they run this test, a lot of people might take offense to that, kind of that it implies more about your mental health. So I think it definitely addresses the stigma around mental health, that like the ordering of the diagnostic exam, even though she did like the full physical assessment, could be controversial. I think it like focuses around that stigma.
I think the physical assessment was important. I just wish that she um, kind of got to know him a little bit more. I feel like um, she easily like ruled out depression because of his answers on a survey that he took, or a questionnaire, and that was like the only thing that she based it on. And it's like he very well could not have depression, but I don't know. I just personally, for me, I don't think a provider should like base their entire diagnosis just on that one piece. Like it's an important component in the patient's diagnosis, but you should also take into consideration, maybe did they understand the questions that they were being asked? Did they answer them the way that they wanted to answer, or the way that they thought the provider wanted them to answer? Um, I feel like when it comes to depression, I just think that providers should spend more time with their patients in order to understand whether they do have depression or not. But other than that, I thought she did a great job too. So.
Yeah, I get what you're saying, Giovanna. It's really hard because in the case study, it says like over the next several appointments, and we don't get to really read what goes on. So it's hard to say like what was discussed and like what was ruled out so easily and like what was on the survey. So that's definitely hard to determine if it was a thorough like report that was developed. But the next question, do you think Mo's brother, Ray, is a good support system for Mo to lean on as he tries to combat his anxiety?
I think he, like I said earlier, definitely has his best interests at heart, but I think he should use him as like the last rung of support. Like if he reach like stuff really hits the fan, call him. But like the way he words stuff is only gonna cause Mo more anxiety and stuff like that. So I mean, he's definitely good to have on call and just in case, but I'd look for other options before giving him a call.
Okay, so the next question or statement, explain the role of stigma in Mo's case.
For Mo with his job, like he said that like he would go blank when he'd be talking and notice that people were looking at him, or that like he would stutter or fumble on his words or just mumble and lose train of thought. Like he was very anxious at work, and with that can definitely bring about quite a bit of like stigma, and that like, ugh, like what is wrong with this guy, like why can't he just talk normal, like you're at work, come on. So that can bring up like a lot of negativity and stigma being at work, the fact that it's affecting him um, the way that it is.
Great. So the last question is, how could have Dr. Tolgan rephrased her outlook on Mo's prognosis and treatment plan?
I think just kind of making it more realistic that, oh, like, no need to worry. Just kind of like we said earlier, be like, oh, it's definitely manageable, but you're gonna have to do X, X, and X.
I'd probably tell him that it's a journey. It's not like a cure, because anxiety, there really isn't a cure for it, and that there's small steps to things. It's like Pat said, be realistic with the goals and something that he can manage if he continue to work, stuff like that.
Yeah, I agree with you both. So that's all that I have for the discussion questions. If anyone has any last minute thoughts or questions. If not, thank you guys for listening. And I'll stop the recording.
Thank you. Great presentation.
Thank you.
Yeah, great